Good morning once again. On behalf of the Community Health Impact Coalition, I would like to thank you very much for finding time this morning to be able to join us in an important conversation, transforming healthcare, integrating professional community health workers into health systems in one term. And I think the thing that I want to emphasize is one term, because the choices that we make today, the policies that we make today, when we have the opportunity to, can transform health systems forever. SHIKI is a team of community health workers and allied health organizations from over 60 countries across the globe. We work together to make professional community health workers, or proCHWs, the norm worldwide. I would like to extend a warm welcome to the Ministries of Health and their representatives who have joined us today. We would like to recognize the Ministry of Health, Belize, Ministry of Health, Kenya, Ministry of Health, Tanzania, Ministry of Health, Burkina Faso, Ministry of Health, Uganda, and many others that have found the time to join us this morning. We appreciate you and we thank you very much for finding the time. We also have allies and partners joining us today. We have UNICEF, WHO, Gavi, Global Fund, Africa CDC, and other colleagues. Please feel welcome this morning. Like I said earlier, I see very many familiar faces in the room. But for those who have not had the opportunity to meet in person, my name is Julius Mbea. I'm co-CEO of Luala Community Alliance in Kenya. We work with the Ministry of Health at the national and sub-national level to make and advance health for communities across Kenya. We are currently supporting over 8,200 community health workers, reaching about 2.8 million people in Kenya. And together with our coalition partners in CHU for UHC, we are advancing systems change that would make proCHWs the norm in Kenya. Collectively, as a coalition, we believe that there are two great injustices happening at the moment. On the one hand, half of the world's population are not accessing healthcare services, and they are not experiencing the right to health, which is a human right. Conversely, we have millions of community health workers that are unrecognized, unpaid, unsupervised, not digitized, and not integrated into the health system. What if one policy change could change all that? One policy change can revolutionize health systems and can make this a possibility for people worldwide. In the face of the many challenges that we are facing, political instability, climate change, armed conflict, pandemic risks, and even the risks that we have in funding, investing in professional community health workers who are skilled, supervised, digitized, supplied, is a strategic decision. And while today's challenges might be daunting, the evidence is clear. proCHWs are cost-effective when it comes to delivery of healthcare, even in the toughest of times. In Kenya, for example, we have seen what professionalization of community health workers can help achieve. COVID-19 is a constant reminder to us of how community health workers and proCHWs can actually buttress health systems. The community health workers in Kenya have been equipped to screen for NCDs. The latest data show that more than 8 million households are registered into our electronic community health information system. 400,000 plus people have been screened and referred for NCDs. CHWs are supporting disease surveillance, and that data is available and has the Ministry of Health can have visibility as a result of digitization. In the case of flooding last year, community health workers were at the forefront in the response. They helped map out hotspots, and they were able to help government direct support and resources where people needed them the most. As a coalition of CHIC, we are on a mission to make proCHWs the norm worldwide. And because health is both technical and political, we are in the business of whole systems change. This means that together we can create evidence for international guidelines, influence our governments and partners, and financing institutions for more better funding. That will ultimately deliver the proCHW policy in many, many places. We have an exciting morning today. We'll be listening to community health worker advocates themselves. We'll be listening to our Ministry of Health partners. We'll be listening to our allies. And at the end of it all, I hope that we'll leave here knowing something, and we'll be more committed to acting together, because to integrate and scale proCHWs into our health systems, we can be able to turn that into health impact. It is now my privilege to welcome to the stage Sania Nishar, the CEO of Gavi, the Vaccine Alliance, and my very employer, Millicent Miruka, a community health worker, a community health promoter from Kenya. And together they will be discussing interesting topics on the conditions enabling proCHWs. Welcome to both of you. Thank you.
Okay, thank you so much, Mr. Julius, for the good introduction. Good morning, everyone. Yeah, I'm so excited that I'm here today, and I want to welcome everybody in this session. My name is Millicent Miruka. I'm a community health worker working from Migori County in Kenya. I'm working under Ministry of Health, and I'm also a Lwala-supported community health worker. And so, before we proceed with the session, I would like to introduce other community health workers who are in the house today. Can you please stand up and wave to the congregation? The community health workers who are around, and our supervisor is also here. Can you please wave? Okay, can you? Yeah. Thank you so much for celebrating the community health workers for the work that we are doing in the community. I want to say that I'm so excited today to be joined by Dr. Sania. And before we proceed, I would like to give her a chance to introduce herself. Welcome, Dr. Sania.
Thank you very much, Millicent, and let me thank Sheikh for giving me this opportunity to be here with all of you. Any session on community health workers during the week of UNGA, during the week of the World Health Assembly is my favorite session. So I really want to thank you for giving me this opportunity, and I'm wearing your pin already. And thank you, Julius, for the kind introduction. I'm the CEO of Gavi, but my claim to fame is that I'm a long-standing supporter of CHWs.
Thank you so much, Dr. Sania, and that's very interesting. Before we proceed, I just want to say that I know that both you and I are advocates for community health workers, work that we are doing in the community. And so, we both understand that community health workers need to be professionalized, meaning that we want fair pay, we want to be trained, we want to be equipped, we want to be supervised, and also we want to get an opportunity for career advancement. Now, can can you tell the audience what is the importance of community health workers in immunization? And you can start by explaining Gavi's mission in reaching zero-dose children. Welcome.
So thank you very much for those questions. Gavi's mission is to reach every child with immunization. Immunization is one of the most important public health measures. It saves lives. It's a tugboat for other interventions as well. If you build a system around immunization, that system can be used for everything else. And at the heart of this are community health workers, because we can provide the fridges in the primary health care facilities, we can provide the guidelines, we can provide the vaccines on the tarmac, we can invest in the logistics system that gets those vaccines into the cold fridges. We can support everything else, but if community health workers are not at the heart of the equation, if they're not committing to creating awareness about public health measures in the communities, if they're not committed to putting vaccines into the arms, if they're not there to front-end the outreach activities, to take the vaccines to the last mile, I'm sure you would know that in many countries, in many settings, in many last-mile operations, communities are hours away from the last primary health care endpoint. Hours away, miles away. And it is community health workers that create awareness. It is community health workers that carry ice boxes on their shoulders. Ice boxes are not light by any means. They're the ones who take it to the last mile. They're the ones who knock at the door. Tell the mothers that the vaccine is available. Tell the mothers that the camp is going to be set up on such and such date. They're the ones who create confidence about the vaccines and about the many other public health tools that you disseminate. Vaccines are not the only ones that you talk about contraception and high blood pressure and screening for NCDs and about prevention for malaria, and you're the ones who distribute the bed nets. And if the community health workers are not there to take these interventions to the last mile through outreach activities and man the primary health centers at the last posts. I've had the privilege of traveling extensively in Africa, in many of our implementing countries, and many primary health care centers do not have doctors sitting there, do not have paramedics sitting there. It is community health workers who have the knowledge and the expertise and who have the trust in the communities they serve that are serving people. And they are at the heart of our immunization operations. So, which is why I feel so strongly about the need to support them. I feel so strongly about the need to professionalize, institutionalize them into the health worker equation in countries, integrate them into health system, give them all the respect that other categories of health workers have. So it's a long-winded way of saying I have enormous respect for the work you do. And I genuinely believe that if community health workers are further strengthened, all our aspirations for public health outcomes would be far better served.
Wow, thank you so much. Thank you so much, Dr. Sanya. I agree that immunization is very important. And in fact, from where I'm coming from, we always say that vaccines are like armor that protects us from getting sick. And so, no human being should suffer from the diseases that can be prevented. Thank you so much, Dr. Sanya. And so, now we want to move to the next question. That is all about gender and community health workers. We all know that 70% of community health workers are women like me. Do you think gender affects the movement to professionalize community health workers?
So gender is a very important part of the community health workers equation. As you know, community health workers are largely women. Yeah. And these are women who are at a certain stage in their career, and they're typically of a certain age. There are younger women. And younger women in community settings, in poor communities, sometimes in disadvantaged urban settings, sometimes in remote rural settings, have a set of problems. They're young, and young women are vulnerable. And your work is in the field. So I know that women who go out in the field, knocking on every door in every house, are sometimes unprotected. You know, there are all kinds of indecent advances that they have to contend with. And then, of course, they are living in homes where husbands are sometimes not very supportive of them going out. Fathers are not supportive of them going out. You know, in patriarchal societies, brothers object from them going door to door. Some of them are married, some of them are not married. The ones who are married are, have young children at home. They have mother-in-laws who are objecting to them leaving small children at home and going out into the field. They don't understand the value of their work. And sometimes they are not respected as they should. I have seen young community health workers who face abuse at home. You know, fathers are not supportive, brothers are not supportive. They're complaining to the in-laws. Why is she going out? You know, the in-laws and the own family ganging up against them. You know, this is not respectful work. Why are you going out? Why are you leaving children at home? And the poor woman is pregnant. She suffers from morning sickness. She's cooking the meal late at night. She's physically tired. She's on her feet. She's carrying an icebox on her shoulders. She's got a huge amount of work, and she's suffering from abuse in her own family, in her in-laws. She's suffering from morning sickness. She has little children. She's cooking at night, and nobody appreciates her work. She's going out into the field, and she's a subject of sexual indecent advances. And on top of that, she's not paid. She's not paid. I mean, for heaven's sake, what kind of world are we living in? Which is why I so respect the ministers who I know are professionalizing the service. One of them is sitting here, Mr. Kargugu. Yesterday we heard from the Minister of Guinea, and he talked about how the 12,000 health workers are being paid $80 a month. Well, $80 is very little, but at least it's better than not paying them anything. And I think this is a scar on our faces that we must wash off. You know, people in the communities at the last mile, these community health workers, are faceless. I've worked with them extensively. I was the Minister of Social Protection in Pakistan for 4 years. I had the privilege of being on the ground every day in those 4 years and seeing the anguish of poor communities, seeing the hard work of community health workers battle all these things. You know, the battle of women in their own personal lives and how it interplays with their professional commitment is a story untold everywhere in the world. Everywhere in the world. You have young women who are protecting their honor, who are trying to make things work at home, who are battling with physical tiredness, and who are trying to make a career for themselves and trying to serve communities. They're not paid in the process. This must change.
Okay, thank you so much, Dr. Sanya. And I think that the community health workers' voices must be heard and recognized. For sure, community health workers, they must showcase their skills and not just highlighted as caregivers. I think so. Or is it something like that? Yeah. So we need to train them. We also need to ensure that they are paid fairly and also supported in their work that they are doing. We also need to include their voices in decision making and value what they bring to the table. And lastly, I want to say that, Dr. Sanya, there is a common saying that goes like this in our community, that when you uplift a woman, you uplift the whole community. Yeah, and so when you strengthen a woman community health worker, we strengthen the health system as a whole. Thank you so much, Dr. Sanya.
Well, let me ask you some questions, Millicent. And perhaps we can trade the microphones on. So let me ask you some questions. What do you need from the CEO of Gavi?
Okay, thank you so much, Dr. Okay, in my experience, from the CEO of Gavi, we want to professionalize community health workers. Yeah, because we are doing a lot in the community. We want to be paid fairly and consistently. We also want opportunity for career advancement. Yeah.
So perhaps I should start asking every minister, like Minister Kargugu, this question every time. Every time we support a funding application, Minister Kargugu, what they have done for community health workers. Perhaps that can be our contribution. That's something I can do.
Thank you so much. Okay, thank you so much, Dr. Sanya, for that. Very interesting. Could you tell me more about Gavi's role and commitment to community health workers, and also your role in funding community health workers programs?
So Gavi has a new health system strategy, and as part of that health system strategy, community health workers are, support to community health workers is an integral part of that. We are working with our partner and organization, the Global Fund, who also bring a lot of value to the table in supporting community health workers. And then we are working with Africa Frontline First to identify critical gaps in community health investments for immunization at the last mile in selected countries. And this includes our work with Guinea-Bissau. But let me ask you questions. Millicent, I'm interested in hearing your, I'm interested in hearing your perspective. Give some more granularity, give some more detail to how I can support you better. You see, Gavi is a funding organization. So we fund countries. Tell me what I can do more to support you better. Of course, you have my voice, and you have my own commitment. And in my interactions with ministers, I keep raising this again and again. And as part of funding applications, we raise this. But tell me how I can support you. But I genuinely have an interest in doing that.
Okay, thank you so much, Dr. Sanya. I just want to start by saying that in my experience, before I say what I want you to support, the support that we want, in my experience, there are a lot of challenges that we are facing. You know, many countries don't understand the importance role, and they don't recognize us as the frontline healthcare workers back in the community. And so as a result, you'll find that we as community health workers, we are working without training, without fair pay, without support, and without supervision. And for you to overcome these challenges, I want to say that governments need to recognize community health workers. Let me just proceed. As a healthcare worker, they want to ensure that we are professionalized. And that is the major thing that we want as community health workers. We want to be professionalized. And again, we also want to be given opportunities for career advancement, just like other healthcare workers. And we want our voices to be included in decision-making so that we can advocate for our roles and our communities. And that is the major thing that we want from your organization.
Thank you, Millicent. That's loud and clear. Please be assured that Gavi will be your supporter. I, in my personal capacity, will continue to raise it in all my interactions with ministers of health. And I just want you to know how much we appreciate your contribution. All community health workers should be very proud of what they do. You really should be very proud of what you do and the value you bring to the society.
Oh, okay, thank you so much. Thank you so much for your time, Dr. Sania. And it has been a privilege speaking to you today. So before we finish, let us leave with the audience with a message, briefly. What should we all focus on during WHA week? What can we focus on?
Well, first of all, the privilege is mine to be sitting next to you, and I genuinely mean that. What should we be focusing on during the week of the WHA? I think we should all focus on the things that matter for humanity. And we should all focus on reaffirming our commitment towards that. Yeah. Sometimes we tend to forget that.
Okay, thank you so much, everyone, for listening to us. And I want to say that the major thing that we should focus, me as a community health worker, is to professionalize us. That is the only thing. Yeah. Because it is an important topic to us as community health workers around the world. And if at all we can achieve it, I tell you that our communities will thrive and our roles will also be supported. Otherwise, thank you so much, Dr. Sania, for having time with me today. I think that we want to move to the next step. And so I will just invite Julius.
You want me out of the stage?
Okay, thank you so much, Mr. Julius, for the time.
Big round of applause for Millicent and team. Thank you so much. That was amazing. I am so sure that if the spotlight was turned on me, I would be sweating. Alice, the stage is yours. We know that we have our permanent secretary from Kenya, Mary, and I know that she's pressed for time. So Alice will be inviting you to the stage to make a few comments, and then we can free you to continue with other engagements. Thank you very much for your patience. Yeah.
Okay. Good morning, everyone. Wow, what an incredibly inspirational conversation. Thank you, Dr. Sani. Thank you, Melissa, for the conversation. It was quite incredible to hear just the power of advocacy, the power of a conversation, and most importantly, the power of the community healthcare workers to make an impact in our local communities. We're going to continue on in this conversation. I have the pleasure of introducing a panelist, which will really speak around the policy work related to community healthcare workers. But first, I would like to invite and welcome our honorable principal and principal secretary, Mary Mathoni, to the stage for some remarks. And thank you very much for your leadership and for your time today.
Wow. Good morning. Good morning. Ain't it a bright morning? You know, in Kenya, they call me community health promoter #1. Because of all the roles that I have put more effort in community health promotion work to make sure that there is comfort and we are leading from the front. My name is Mary Mudhoni. I am the Principal Secretary for Public Health and Professional Standards in the Ministry of Health in Kenya. And I'm very privileged to be here this morning. You know, I had the CHP talk, and you know that is one of our own. And the CEO of Gavi asked her, "What's your ask?" I was almost hinting to her. This should be your ask. But I could see she fumbled because in Kenya, we have actually almost covered everything that is needed to be done to ensure that the community health promoters are doing their very best and with ease. The community health worker then, in which even my own sister used to be a community health worker in the 90s, in the 2000s, was an unrecognized person in the society. In fact, we didn't care who they were. Never mind, they still used to do a lot of work. But when the Kenya Kwanza government in Kenya came into place, the first thing that we did was to recognize them into law. So the Primary Healthcare Act of 2023 in Kenya recognizes and defines who is a community health promoter. And we called them promoters. Initially, they used to be volunteers. Now we call them promoters because we want health education to be taken seriously at the bottom of the pyramid. Initially, nobody would recognize these people and pay them. When the government came into place, we put them into law in the Primary Healthcare Act, and we pay them a stipend. Rome was never built in a day. Albeit it may not be as enough, as she said, yes, but at least we have started somewhere. And this is where I call for collaboration, because the government, and through the dwindling funds, donor funds, and equally the fiscal space that the government may be in, we may not afford to pay as much money to the community health promoter. We have 107,831 community health promoters in Kenya. And every community health promoter services 100 households. So in a month, we expect you to at least have visited every household, a household. And the one thing that we have also done to professionalize them is to kit them. They have a kit that has commodities, that has drugs, that has equipment to help them in their work. It's a portable kit, simply a bag. We remunerate them. We are training them continuously, because we believe in professionalism. We equally have digitized everything that they do. So we have provided them with a smartphone. And the one thing that they do with that smartphone, when they get to the household, they take your blood pressure, check your blood sugar, remind caregivers and mothers of when to take their children for immunization and how to also go for prenatal and postnatal care. And they have been trained on how to assess common childhood ailments so that the children are able to be taken to the health facility at a good time. We are working on career progression. Issue supervision, we already have a structure on how they can be integrated, and especially through our referral system. Our community health promoter is our level 1 in our country. Therefore, these are issues that we have been able to do as a country, but we are not yet there because we want matters prevention and promotion to take the center stage in our country. The legal and policy reforms that we have done, setting up the Primary Healthcare Act, the Digital Health Act of 2023, the Social Health Insurance Act of 2023, and the Facility Improvement Financing Act of 2023. All 4 laws assist the community health promoter in terms of operationalizing their workplace. And the Facility Improvement Financing, again, it is to ensure that we are ring-fencing all funds that are meant for health. Initially, we would see when the funds are taken to the governments, the county governments, then they are reallocated to do other work. Right now, if it is meant for the stipend for the CHWs, nobody can touch it. When the community health promoter initially would carry very heavy books to keep records. Right now, they simply have a smartphone that takes data, and this helps us in terms of planning ahead on how much that we need for the community health promoter and other ailments in the country. And we are also able to collect data for future. I know my time is running up, so I have summarized my speech so that I don't just read. And if you ask me, the one thing that we must do for the community health promotion is ensure that they have continuous training to equip them with the skill that can help them in their work at the community level. That we are doing in our country, but collaboration is key. SDG 17 talks about partnerships, and that's why we are in this room today, to get to know, to learn from each other, and also collaborate with the strengths that we have. Maybe in our country, we may have the legislation, we may have the stipend, but there is also other things that we need to continually employ to ensure that the community health worker is safe. Gender issues. I heard them talk about women and women in the communities. In our country, women have come out very strongly in terms of leadership, right from the cabinet level to legislatures, and also with the community health promoters. Majority of them are women. And this we have entrenched even at the base, at the community level. We have committees, the hospital committees, where the community health promoter is supposed to sit at the decision-making level. And because most of them are women, they are also able to participate in these committees to ensure that there's progress, to ensure that their issues are catered for. They work closely with the national government administration to ensure that there is peace in the communities. Therefore, gender issues have really been taken care of. And even in our social health insurance fund, at the moment, we have entrenched that there's a gender desk in every facility and in every of the police stations that we have in Kenya. so that should there be an issue in the community, then they are catered for. My time is up. We can talk more and more about community health promotion, because health is wealth and prevention is better than cure. Indeed, public health and primary health care is health. Thank you very much and have a good morning.
Thank you, Honorable Minister, for those incredible remarks and for the inspiration. Thank you also to your sister as a community healthcare worker and all that she has done for our health as well. I'm going to move us quickly along because we have three amazing panelists coming here to speak and who will really bring to life what I've heard around this room around collaboration and then more importantly around action and impact. And so with that, let me welcome our speakers to the stage. For those who are at the tables as well, you'll have a translator device in case that you would need that as well. It's quite easy to put on in case you want to take a minute as well to do that as I call up our stage panelists. First, I'd like to call Honorable Robert Lucien Kargugu, the Minister of Health of Burkina Faso. I'd like to invite up Catherine Kane, our Technical Health Workforce Department from the World Health Organization. And last but not least, Saida Shista, who is our Community Healthcare Worker Supervisor from Kenya. And we've got one more in our speaker spot, the Dr. Andre Rohan Chell, who's our delegate from the Minister of Health in Belize. Thank you so much. Thank you very much for joining us this morning, and hope you've been enjoying the panels. We are going to have a conversation around community healthcare workers, policies, and then how it looks in your individual countries and in your individual communities as well. If I can please start with our Honorable Robert Lucien Kargugu from our Burkina Faso Ministry of Health. We have many success stories in the room, but Burkina Faso particularly is a great success story in advancing community healthcare worker reforms in a single ministerial term. I'd love to ask you, what enabled this progress in your country? Thank you.
Alors, merci beaucoup. So, your end says. Alors, merci beaucoup.
Thank you very much. First of all, I have to say that Burkina Faso is a country that has many traditions in terms of community health. It's been 40 years now since the revolution by Thomas Sankara. We have 2 community health workers per village in Burkina. Then, of course, with the political situation and everything that has gone on, you know that we haven't been able to push this further, and we have lost some of what we had acquired. But it's been a few years since we've tried to push back and invest. And the investments have increased recently. In Burkina Faso, we have an army, if I may allow myself, of community health workers, with over 30,000 community health workers, and each and every one of them is trained. It's a 3-week training that is provided with a number of modules that are prioritized, so child-borne diseases, family planning, and many more. Each community worker is given a stipend of $40 a month, And of course, we know that that is insufficient, but 50% of these $40 or $20 are covered by the government's budget.
Les 20 autodollars sont assurés.
And we are supported by financial and technical partners, such as the Global Fund,
Alors, donc, comme je disais,
just as I said previously, the community health workers receive a stipend of $40 a month, which is insured by financial and technical partners, just like Global Fund and Gavi. For this, so this covers community health workers, 30,000 workers, which of course is insufficient, but it's a start. And above them, we have what we call the professional community health workers. And these workers are trained for a period of 18 months in our public training course, and they have real recognition. We are now ensuring the link between the professionalization of the community health workers to the professional community health worker level. And for this, we are setting up a certification procedure for the community health workers who are trained over a period of 20 days and who have worked vocationally for a certain period of time can then move on to the higher level and be recruited as a civil servant. So recently, the government recruited 200 community health workers, and among these 200, we have a quota of 50% that will be able to move up to the professional level. So it's something that we are putting in place progressively in order to integrate as many local community workers as possible. And these local agents are, when they move up to the professional level, they are paid about $150 American or a little more. So they are integrated as a civil servant, and that is enough for a decent salary. Now, what we are doing is setting up the profession with Living Us and Gavi and other partners who provide financial and technical support. That's what we are coordinating at the moment, and this is to say that we are heading towards the improvement of this profession, and we are trying to anchor it into our network of civil servants, and we want to present the public health code that will, of course, cover this profession of community health workers and protect them as their status is recognized. And I hope that in the months to come, we will be able to share the happy news and the lessons learned from this experience in Burkina. Thank you very much.
Thank you very much, Honorable Minister. It was incredible to hear some of the various steps in order to take to where you are today. What I picked up as well was that the journey is not done, and the continuous progression of community healthcare workers within your country and the recognition alongside of it was a lot of the inspiration around where you've been. Maybe I can turn to the other side of our table today and ask a question as well to Dr. Andre Chell, our minister delegate from Belize. Thank you for joining us. Maybe if we can go to your country now, could I ask you to tell us a little bit about the progress to date in Belize in making sure that our community healthcare workers are paid and accredited?
Thank you. Yeah, thank you, and thank you for the invitation. Unfortunately, the Minister of Health couldn't be here. He has his statement today at the World Health Assembly. But I must say that the Community Health Worker Program in Belize was established almost 43 years ago. Over the last 4 decades, I mean, we have made significant strides when it comes to ensuring that we integrate community health workers as part of the formal health system. For years, you know, they had been receiving the most minimum stipend, but in 2023, as a priority for the Ministry of Health and the government of Belize, we increased that stipend to $250 monthly. And it's something that was long overdue, and it was a form of recognition and motivation, and also to retain our community health workers. We have also been partnering a lot with UNICEF country office in Belize, who the office has helped us in actually standardizing the training manual for community health workers. Before, Belize is a small country, so we have 4 health regions, and before the training was done in a not so standardized way, but now with the actual formal manual that guides this training, we now have that process of formally training them, giving them the certification as well for them to practice as community health workers, and ensuring that we maintain the high quality service too that the population deserves, right? So I think that is where we currently are. In terms of strategic planning and policy, we recently launched our updated 10-year health sector strategic plan. And in that plan, we really highlight the importance of community health and, of course, the community health worker program. I think it's important for us as a ministry and also as a small developing country to ensure that we have the sustainability mechanisms to ensure that we rely on our own funding, you know, and not only on outside donors. I think that's very important for us to keep in mind. We are in the process of developing our first ever community health strategy. And in that strategy, again, we are looking to formalize, integrate. I know the community health worker from Kenya made a very important note of career advancement. I worked in my dissertation last year, and my dissertation focused on optimizing the community health worker program in Belize. And research indicated that the reason why they were unhappy is because they lacked that career advancement opportunities, that motivation, that recognition, and that formal integration into the healthcare system. So I think that's important for us to keep in mind, and as we move forward to ensure that our policies and our strategic plans, our operational plans also have them as a priority. I mean, as a government, we have prioritized them as a key pillar in primary health care. It's a matter now of sustainability and ensuring that as we move forward, we keep that in mind.
Thank you very much, Dr. Chels. Great to hear a bit more about how Belize is putting community healthcare worker into the professionalization, into the accreditation. You mentioned words such as standardization, sustainability, an important word today and within our context. And as we continue on, I'd like to turn to Catherine Kane from the Health Organization to really talk a bit more about the guidelines for community healthcare workers. They were released in 2018. Was a landmark moment, and I think a lot of what had happened since then was due to some of these guidelines as well. And so I'd love to hear a bit more from you about the professional community healthcare worker movement, and maybe just reflect a bit around the progress to date and where you see the work happening in the future.
As a community health worker, do we hear that? I've been one early in my career. I consider myself still to be part of you. We understand the arc of what this means. We are a community. We are a community of community health workers. We are a community of health workers. We are a community of people concerned with providing health. So my job at WHO, I would be remiss if I didn't recognize a member of my community who actually led the development of the Community Health Worker Guideline. Say hello to Giorgio Cometto in back. I got to launch it at the World Health Assembly. I got to develop a number of the derivative products. I get to contribute to these. I get to have conversations with all of you. My life is really, really good because I have partners and I have a team. And one of the things that we try to do at WHO is develop the evidence, develop the data, develop the relationships, the partnerships, the dialogue to influence decision-making at the highest level. We are connecting you with your fellow health workers. We are connecting the health sector with the labor sector, the education sector, the finance sector. We're connecting you with global dialogue. So what are we seeing right now? We've got governments who are spending more on their debt burden. I'm going to bring the highlights and then come down. We've got governments who spend more on servicing their debt burden than they spend on health and social care. It is time to ask political leaders beyond ministers of health. It is time for the community to say, what do you value for the health of your people? Do you value your health? Do you value gender? So I'm going to bring in another element of this. We have health economists who work on our team. A labor economist is a great person. It's a person who looks at money and people together. Our health economists came out 2 years ago with the Fair Share for Health and Care report. How many people here have heard the difference between what men and women make for the same work in the same sector, which is health and care? Anyone? All right, bring it. Ms. Linsky, what's the difference? What's the gender pay gap?
Oh, I don't know the exact number. I know it's a big gap.
It's 24% globally for health workers. That gets bigger and more interesting when we bring it to community health workers, but we are bringing that dialogue in. Why do women make less? Because we value the work less. Women form 67% for anybody who's using 67% of the global health and care workforce. In community health workers, the data varies by region. The African region, for example, 79% of the CHW workforce. But we are bringing those discussions on where we value work in health and care. That's important for CHWs. We are bringing those discussions to the global conversation. What else are we doing? We drive the Community Health Worker Guideline. When we talked in Astana in October 2018, we didn't say we're going to talk about community health workers. We talked about primary health care. So what does that mean? Integrated, interdisciplinary teams working in communities to deliver health. Part of the really important elements of the CHW guideline, and you've heard them from every speaker here. What does that say to you? 7 years, every single bit of dialogue talks about the 15 recommendations of the CHW guideline. Why is that? It's not because of me. God bless him, love my colleague Giorgio. It's not because of him. It's because we have a community of partners working on this. We have a community of partners working on investment strategies. Africa Health Workforce Investment Strategy, for example, looks at financing the health workforce. We are looking at how to connect community health workers, their expertise, their community knowledge with health systems. We want to bring the health systems closer to communities. We want to bring the supply chain closer to communities. I was sitting with a junior doctor this morning, an early career doctor this morning. He's looking at how to get the supply chain stronger to communities. Anybody who's been a community health worker knows that this is a really big deal. If you don't have the rapid diagnostic test, you can say, well, it looks like malaria. If you do have the RAT, you say looks like malaria, but then you don't have the treatment, the community knows how to look around and say looks like malaria, but they come to you for treatment. So we're working to get that supply chain to you. We are working in the formalization of community health workers, that recognition within the whole system. It's not just the system and the national government saying, yes, that's a community health worker, yes, they're in policy. It's actually your whole team. It's your supervisor, it's your nurses, it's your doctor. So when you see somebody in the community who requires better care, who requires more advanced care, you're able to go and say, you need to go to the hospital here, I'm referring you. And when you get to the hospital, the health worker there recognizes it, recognizes your expertise, your training, your continuous learning, and says, yes, we take this patient, we are going to serve the needs of this patient, takes your data, understands what's happening in the communities. So we are working to reduce the silos between programs, we're working to reduce the silos between sectors. We're working to reduce the silos between interdisciplinary teams and bring the same focus to community health workers that we bring to the broader health workforce. What should you be looking at? I know my time is so up. But why are we here? Anybody? World Health Assembly. We're here for formalization of community health workers. We are here to advocate for attention to the global health workforce. We're here to talk about why health workforce is important. At the World Health Assembly, and you can see this on our website, we report on community health workers. We report on nationally validated data from ministers of health, because they've designated somebody to do this, that tells you how many there are, who they are, where they're coming from, what their gender balance is. We look at the broader community to bring in greater data, but we have a report on community health workers, 93 countries. In the Global Strategy on Human Resources for Health Progress Report, reported on community health workers. There are 4 million globally. In some countries, they form 27% in the African region. They form 27% of the health workforce. Doctors, 0.18, nurses, 0.27. So we got a big sector of the health workforce, but we want you to advance. I'm getting a 1-minute warning. We're working for you. We are working for you by progressively reporting on your data. We are working for you by working with your ministries. We're working for you by working with partners to bring this all together. And I encourage you all to listen in. Could be Thursday, could be Friday. Wait and see, but wait and celebrate. We have a resolution. Again, we're at the World Health Assembly. We have a resolution called Accelerating Progress on the Global Health and Care Workforce by 2030. It includes, one more thing, Global Health and Care Worker Compact. That's your rights and privileges. You are part of this. I'm gonna stop, but we're the guardians of that as well. We're here for you. Watch the resolution.
Thank you so much, Catherine. We could sense your passion and energy. Thank you for what you're doing at the WHO. And what I heard a lot of was how those guidelines spearheaded some of this, but it was this community that really kept bringing it to life. And so I am going to quickly turn it to, and we're going to go to Kenya, and I'm going to really turn it over to Saida to speak a little bit around how this has impacted her and has impacted her as a community health worker supervisor on the ground. What does your day look like? You know, we talked a lot about standards and data and compensation and career progression. Tell us what it's like on the ground.
Good morning, everyone. Good morning. I'm Saida Shise-Odwor, a community health assistant from Kenya, Kakamega County, Likuyan Sub-County, Kongon Health Center, if I may go down to that point. I manage 5 community health units with a total of 50 community health workers. And I manage a whole ward of approximately a population of more than 30,000 people, a population of about 6,000 plus households. So my day as a community health worker is dynamic, and I don't have a formula for my day because I work as per the activities. I make my work plan for the week, but I end up not following the work plan because we may have planned to do this, and then another thing comes up. Because my work, I work with the administration. I have community engagements, I have facility engagements, and I have supervision to do. So in the morning, that is the first thing I do when I go to a facility. I have to meet the healthcare workers to give me a report of what might have happened, maybe in the night, because our health facility does the deliveries. So I must get a report from them if there is anything that came up that I need to tackle, especially from the community, like pregnant mothers. Sometimes a pregnant mother comes for delivery. That mother has never been in any antenatal clinic because of the fears or because of her own reasons. So by getting such a report, I find out who is the community health worker of that client, and then we sort out why this mother was not reached by a community health worker. After that, now I have my own community engagement I have the community dialogue days, I have the planned action days in the community, and most of the time I collaborate with the local administration because I realize that when we do mobilization as community health workers, the turn-up is very low. But when the mobilization is done by the local administration from the village elders, the sub-chiefs, the chiefs, the turn-up is so high. So I collaborate with them in case they have a community forum. I'm informed and I'm able to reach there and talk one or two about our health, our health. And then after that, I do supervisions for community health workers. I accompany the community health workers in the household to see and to observe, although that will not give you the clear picture of a community health worker, because when you are there with your supervisor, you will perfect everything. So we cannot get a clear picture of the community health workers, but I came up with a spot check whereby I visit the households, dialogue with the household members about the community health workers, the services they're getting from them, when were you last visited, and all that. So from the spot check, you can at least tell when the community health worker is working or not. So I don't have a formula for the day, but those are the activities I do. Thank you.
Thank you so much for those inspiring words and what you do every day for us, Saida. And if I can thank all of our panelists for an incredible conversation today and for your continued commitment for community healthcare workers. Thank you to Sheik as well for organizing this event. And I have the pleasure of introducing Malika Raghavan, who is from Last Mile Health, one of our Sheik members, and she will be doing our closing remarks. Thank you.
All right, good morning. I have the tough job of closing us out, especially after a lot of wonderful speakers, but I'll try to keep it short. So for those of you who don't know me, my name is Malika Raghavan. I'm our Deputy Chief Program Officer at Last Mile Health. I'm also privileged to serve on the board, the advisory board of Sheik. At Last Mile Health's founding, we were called Tiatain Health, and in the local Liberian language of Kron, that means justice and health, which I think is very fitting for our context today. Last Mile Health is proud to be a co-founder of Sheik. Our mission is to save lives in the world's most remote communities. And an estimated 2 billion people live outside of the reach of the health system globally. This problem is so much bigger than any one organization alone. So we are committed to collective action to solve this together at scale. Powered by the commitment of operating as a team at Sheik, we know we can make real progress if we go together. So why community health workers? As we've heard so beautifully today from Saida, from Millicent, from Dr. Nishar, integrating professional community health workers into national health systems improves access, it improves quality, it improves health outcomes, and it is a cost-effective investment. Community health workers are at the forefront of tackling global challenges, like pandemics, and they offer local solutions at the point of care, ensuring that we are all safe and secure. In crisis and in calm, professional community health workers are always a no regrets investment. Every $1 invested in community health workers can yield up to $10 in economic and health gains through reduced costs, improved productivity, and jobs creation. But it's not just the smart thing to do, it's the right thing to do, and most importantly, it is the just thing to do. I saw this firsthand when I was based in Liberia during the Ebola epidemic and partnering with the Ministry of Health to design, deploy, and scale the country's first ever harmonized national community health worker program. Now, nearly 10 years since the program was launched, Liberia's program has been named a global exemplar, and community health workers are treating over 50% of malaria cases for children under 5. Importantly, Liberia shows us what's possible when countries invest in pro-CHWs and keep communities who are so often out of reach at the front and center of the agenda. So what's next? This is why at the Coalition, we are on the mission to secure professional community health workers and CHW policy in 95 countries. But how do we get there? As we learned from our honorable ministry delegations, political leadership is paramount, and institutionalization is possible within a single governmental term, as seen in countries like Liberia, like Ethiopia, and like Burkina Faso. But we also need the global momentum and the proven tools. WHO guidelines and global frameworks offer step-by-step guidance for designing, costing, and scaling pro-CHW programs. But we also need donors and multilaterals to enhance impact and align funding with national community health worker strategies and commit to transparency and coordination. In the current context of aid cuts, this becomes ever more important. But let me put it simply. If you're a policymaker, this is your legacy project. Adopt pro-CHW national policy. If you're a funder, invest in pro-CHWs and make it a requirement for funding. And if you're a CHW or an allied organization, join the movement and make your voice heard. Together, we will transform healthcare and guarantee health for all, including those who provide it. Thank you for your commitment to community health workers, for continuing to advocate and fight for professionalization, and for being part of a movement that is so much bigger than any one of us alone. Thank you so much. Have a great week.